I think there'll be just a few minutes because I'd loaded my slides, but it's not coming here, so it'll take maybe another minute or two. I now go on to the second part of my short lecture, which looks at hypothyroidism in type 2 diabetes. And this is a paper which we published in the Indian Journal of Endocrinology and Metabolism 2 years back, which looked at 8 cities of India and looked at the prevalence of hypothyroidism of India, and we studied about 5,000 patients, and we found that the prevalence of hypothyroidism in India is about 11%, and the prevalence of undiagnosed proper primary hypothyroidism is 3.5%, 3.46% to be precise, and we found that the prevalence of subclinical hypothyroidism is about 8%. Self-reported cases, these are self-reported cases, so we've ignored them. These are patients who came with thyroiditis, so it's not important to look at them. If you look at the undiagnosed burden, it's about 1 in 10 Indians seem to have an undiagnosed thyroid hypothyroidism, either subclinical or overt, and this seems to be across India, and this was done in urban cities, and in our study we found that 88% of these subjects were taking iodized salt. So despite iodization, we found that there is hypothyroidism, and if I remember correctly, about 20 to 25% had anti-TPO antibody positivity also. Well, because of this presentation, I tried to pull out my data to look at what happened, what was the prevalence of diabetes in these patients who had hypothyroidism, what is the prevalence of hypothyroidism in these patients with diabetes. So since this is a Diabetes India meeting, I decided to look at what proportion of people with diabetes seem to have hypothyroidism, and more importantly, is the presence of type 2 diabetes. Remember, we finished type 1, we are talking type 2 here. Is the presence of type 2 diabetes increasing some risk of hypothyroidism? Because people are all talking about thyroid disease is common in diabetes and all that. So we looked at, this is unpublished data, but this is data on good number of subjects. We had 933 subjects with diabetes, 630 subjects with pre-diabetes, and 1,324 subjects who didn't have diabetes, and this is from 8 cities of India. So it is a nationally, at least to some extent, slightly representative study. What we found is that these green skyscrapers represent overt hypothyroidism, and the blue ones represent subclinical hypothyroidism. And if I ask you to draw a mental line across the blue and the green skyscrapers, you might feel that in diabetes it seems to be a little less or a little more, but if you see these numbers, they're not really different. No, subclinical 9.5, 7.5, 8.7, so roughly they are largely the same, and there was statistically no difference in the prevalence of hypothyroidism or subclinical in type 2 diabetes compared to pre-diabetes compared to normal people. So, but nevertheless, if you look at it, about 1 in 10 patients still had hypothyroidism. So hypothyroidism is present, but I don't think that type 2 diabetes people have more hypothyroidism than normal people or something. We didn't find that. Whereas in type 1 diabetes we found 30%, 20 to 30% at TPO antibodies and hypothyroidism. When we also studied the prevalence of TPO antibodies in patients without diabetes, pre-diabetes and diabetes, and again, while these skyscrapers look very, very different, these bars look very, very different, just look at the numbers, they're virtually the same. 22% in people without diabetes, 23% in pre-diabetes, 20% in diabetes, and really reasonably good numbers, 933 people with diabetes and 1,324 without diabetes, really no difference. So really, autoimmune thyroid disease is not commoner in type 2 diabetes or pre-diabetes compared to normal people, and there is no reason why it should be. Type 2 diabetes is not an autoimmune disease, so why should hypothyroidism be common in type 2 diabetes? The prevalence of diabetes in our population was pretty high because this was done in urban India, and it was about 16%. So it was done in the major cities of India, Mumbai, Delhi, Calcutta, Chennai, Goa, Ahmedabad, Calcutta. So I think these were all the cities. We found that really TPO antibodies, there is no difference at all, and diabetes was pretty common. So diabetes and thyroid both common, and their association is more likely to be due to chance if we look at type 2 diabetes. So ladies and gentlemen, I've talked about type 2 diabetes. I'm just going to look at the implications for clinical management now. Early detection of thyroid disease can prevent comorbidities and mortalities, type 2 diabetes we think, but at least morbidity, I think it is important to diagnose. So what is this morbidity that can occur in diabetes if thyroid disease is not diagnosed? Largely, it's all type 1 diabetes. Type 1 diabetes children, type 1 diabetes children in adolescents. I think if you diagnose and treat thyroid disease, hypothyroidism in children and adolescents, you will find that they will have better growth, better puberty, menstruation will be on time, the glucose control stands to be better, weight gain is controlled, academic performance and overall well-being is controlled if you diagnose in type 1 diabetes. In type 2 diabetes, if you detect early hypothyroidism, you may have some benefit in correcting dyslipidemia, and we're not sure whether any other outcomes will be different. So therefore, in type 1 diabetes, please test thyroid functions and anti-TPO once a year. And I come to the end of my talk. I talked about hypothyroidism and diabetes, both common diseases. In type 1 diabetes, it's important that the risk of hypothyroidism is higher, so you need to suspect, screen and keep treating. In type 2 diabetes, that doesn't increase the risk. Just like in normal people, there is a high risk of hypothyroidism. Type 2 diabetes also, there is a high risk of hypothyroidism. So those are the messages I want to leave you with. And ladies and gentlemen, thank you for listening to me. It's a pleasure talking to you.